The first step in diagnosing atrial fibrillation is having a physical exam and health history done. This looks for risk factors related to a history of murmurs or other problems such as heart failure or problems with your thyroid, liver, or kidney. Your doctor will check to see if you have an abnormal blood pressure or heart rate. They'll also check how your heart and lungs sound. If it's found that you have a rapid heartbeat of 90 to 170 beats per minute, you will get an ECG done. This is an electrocardiogram, and a diagnosis of AFib will be made if the ECG shows a rapid heartbeat and that the upper chambers of your heart are beating chaotically. EKGs are just a snapshot of your heart's activity. So a Holter monitor may be ordered if the ECG is negative, but you are still having symptoms. A Holter monitor is a portable ECG that is applied to you by a healthcare professional and is worn for 24 hours. You return the next day and the data are analyzed for any signs of AFib and other abnormal heartbeats that occurred while wearing it. An event monitor is another type of portable ECG that may also be used if the ECG was negative, but symptoms are still present. The monitor is worn from 7 to 30 days or longer in some cases, and a button is pushed when symptoms occur and an ECG strip is recorded. Some lab tests that help diagnose AFib include a CBC or a complete blood count, thyroid levels, electrolytes, liver and renal panels. An echocardiogram may be used. It takes a special picture of your heart made by sound waves, and it looks at the structure and function of the heart while it beats in real time.
Hi, my name is Kala, and I'm going to talk about atrial fibrillation, which is something that your doctor diagnosed you with, and I thought that today we should teach you some things about it. So in a regular, healthy human heart, there are 4 chambers, okay? These 2 upper chambers are the atrium, and these bottom chambers are the ventricles. So blood flows from the atrium to the ventricles and then out to your body. In atrial fibrillation, that electrical impulse and the steadiness of it, it's no longer there and it doesn't exist. When AFib happens, the electrical impulses, they go haywire and it causes chaos in the 2 upper chambers of your heart. And your atrium is no longer beating like this, but there's just so much going on that your atrium goes like this. And the one time that it's able to get an electrical pulse that goes through all the way, your atrium finally contracts and is able to push the blood to the ventricles and then out to your body. So the deadly thing about atrial fibrillation is that that blood is pulling inside of your atrium, and when your blood pulls, it swirls, and sometimes it can create these things called clots. Some of the symptoms for atrial fibrillation are things such as generalized weakness or fatigue. Sometimes individuals that experience atrial fibrillation notice that they have an irregular heartbeat, or that it's a very fast heartbeat. They may experience some dizziness, shortness of breath, or anxiety. They can have chest pain or sweating, and they might be confused.
Hi there, my name is Morgan. I'm one of the nurses here at the clinic. I just wanted to go over some lifestyle changes in regards to AFib. First, let's reduce your alcohol intake because alcohol increases stimulation of the vagal nerve, which can spark an AFib event. If you are female, limit your drinking to 1 glass per day. If you're a male, 2 glasses per day. Next, if you are a patient that has diabetes, it does put you at greater risk for AFib. This is because diabetes affects glucose and insulin levels, which can directly affect the atrium, which can cause AFib. So if you are a patient that has type 2 diabetes, let's go ahead and manage your weight through exercise and diet. If you're a patient that has type 1 diabetes, let's go ahead and check your glucose levels and manage your insulin throughout the day. Next, AFib is believed to be caused by high blood pressure, so getting that blood pressure under control is really important. We need to take the prescribed medication as prescribed by your physician. We should also make lifestyle changes such as weight loss, and you can do that through physical activity and through diet. Next, if you are a patient that has sleep apnea, it is really important to get that under control. That is because the heart is experiencing stressors and chemical changes every single time that you're startled awake from lack of oxygen. So if you are a person that has sleep apnea, it's really important to get a healthy weight under control, as well as using your CPAP machine as directed by your physician. You should also avoid tobacco and nicotine products since they can increase your blood pressure and your heart rate. Lastly, caffeine can trigger an AFib event, although there is very little data proving that. This is because caffeine is a stimulant that speeds up your heart, especially if you're already sensitive to it. So there have been popular energy drinks that have sparked AFib events in teenage boys, so we want to be mindful of that. So AFib is an unpredictable disease for that reason. It is important that you have an understanding that you may still suffer from an attack even if you avoid all the common triggers. So just a recap, it is important to make lifestyle changes such as avoiding nicotine and tobacco products, avoid alcohol or drink in moderation, avoid caffeine if you're sensitive to it, find ways to lose weight and eat healthy, and take your medications as prescribed, including blood pressure medication and insulin. Let me know if you have any questions,
Hi,
okay?
my name is Taylor and I'm a nurse here, and I'm just going to go ahead and give you some education on the different types of treatment options that are going to be available to you. So the first line of treatment and the most common is we're going to go ahead and prescribe probably an anti-dysrhythmic, and it's just going to help bring your heart rate back to a normal rhythm. The most common ones that we use are amiodarone and abitolide. If those don't work, we can go ahead and do like a calcium channel blocker or a beta blocker. Something else that we can do besides the drugs is it's called electrical cardioversion. So that's where, we put the paddles on your chest and we can reset your heart rhythm that way. You would be sedated for this procedure. If you were to do this procedure, sometimes they will put you on anticoagulants for 3 to 4 weeks before they do it, just to prevent clots and any stroke. And then sometimes they'll also have you do it afterwards. Now, for somebody who suffers from atrial fibrillation for more than 48 hours, they will, and none of these other therapies are working, they will put you on a long-term therapy of anticoagulants, and the most common one that we use is warfarin. And if you didn't want to come and do that routine lab work all the time, we can also, there's different ones we can prescribe you that you can do as well. So if all of this doesn't work, and we can cross that bridge, and we can talk a little bit about it when we get there, but there can be other things done, and they can go in surgically, and they can go ahead and fix that electrical impulse by doing, it's called AV node catheter ablation or just catheter ablation, and then they can also do it's called a MACE procedure. Real quickly, I just want to go over some of the side effects of some of these medications. So some common ones are going to be like dizziness, fatigue, nausea, vomiting, GI upset, things like that. You might get a little lightheaded if you stand up too fast. Some things we are going to want you to report, though, if they do happen. So if you're put on anticoagulants, if there's any abnormal bleeding out of the nose, ears, mouth, in urine or stool, we're going to want you to report those immediately to us, and we can lower that dose for you.